Welcome to our program, eHealthcare TV. Today we're talking about change management. Last week, we have discussed about theories in change management. Today, we will have a discussion about reasons for change in target market and response in redundancy cost. I welcome you with my bouncer, Mr. Jose Gonzalez, and with my guests, the Sheikh from Saudi Arabia, Mr. Abdul Shakul, and his interpreter,
Salam.
Mr. Bobolitz Yakos.
Mat.
Viewers, Mr. Abdul Shakul prefers translator rather than himself because he just understands English but he can't speak the language.
Okay.
Guys, before we went to health and social care, what other business did you have and how's your business now? Is it doing good?
Al Maktoum Salam Kibabish.
Mr. Translator?
5 years ago, we are the largest kebab shop in the Europe. But then, we were beaten by Kebaboy shop. Kebaboy shop is really good. And now, healthcare is the biggest market in the UK. So that's why we are decided.
The biggest.
Yeah, Kebaboy.
Yes.
Yeah. Decided to try healthcare services.
And
What made you decide 5 years ago to sell your company and acquire an almost failing care home? Don't you think it's drastic?
No. Al Maktoum Salam is Sharif Al Farouk Kibabish business. Biggest Farouk El Madeira Salam.
Mr. Yagbos?
My previous company only served the upper class, which in turn were affected by recession. My profit dropped by 20%. Then, I was searching for other option of businesses. Based on my statistics, in his statistics, he says that he found out that having a care home business in this country is one of the businesses that having a large profit. That's why we changed from our kebabs business into kebabs care home.
That's a cool name. What can you say, Jose?
And then he came across residential homes. I would say that it was drastic, but
Really?
business is a risk.
I see.
The care home that I've acquired has a lot of potential in terms of location. That it? Siguro?
Siguro.
Yeah. Just like the location, the staff, building structures, and it has 3-star rating by the CQC or the Care Quality Commission.
That's awesome, Mr. Yagbos. Shakul, how much did you invest for the company?
Lada men public 2 million dinar.
He spent 20 million on the care home.
Really? That's much, huh? After 5 years, you have expanded your target market. What is the scope of your target market now? Have you thought to replace the employees in your company and hire newly and qualified staff?
Allahu Akbar. Allah Maktoum Salam El Shaktu Farouk.
Mr. Yagbos?
At present, we have expanded our market from elderly people to patients that suffers a mental illness. Currently, he had 50 employees, including the management, care assistants, and nurses. Redundancy is inevitable. However, it wouldn't not give me any good laying off? Yeah. Any good laying off the employees? There is a certain response for redundancy laws protecting employees. However, he personally assess the potential and knowledge of the staff. They are well-trained, team player, and hard-working individuals. Is it Mr. Shakur?
Jose, what can you say about the expansion they did on their care home? You can do it. You can do it.
Nothing.
To our talk show that you have expanded. Then what?
Wala gi ko magdahom na inaingani karong gabi una, no? Pero bahin sa to sa among negosyo sa bahin na ning atong kibab na care home, malambuon o mayo ang dagan sa among negosyo.
He enrolled employees to courses that will enhance their knowledge on his new target market, which is demented patients or demented patients.
Also, he add up some dementia patients.
Yeah, it's we call it the people with dementia. It was costly, but he invested in it and considered as an asset. Is it what you mean? Yeah, as an asset.
Yeah, suffer.
Also, the council helped in response, in redundancy, and they rendered trainings in support in learning for the skilled employees.
So he invested much then.
Yeah, he invested a lot on those.
Mr. Shakur.
Yes.
So, Mr. Shakur, can I ask you something?
What is it?
How long have you known this Mr. Bolbolits Yagos?
Ako ni siyang ilhan kita nakatuig, no? Mga siguro 8 nakatuig kani mga tao masaligan din siya o may ni siya ang tao. When it comes to mga negosyo like mga care home, masaligan siya.
He knows me for about 8 days.
8 days?
From this month.
Oh.
Yeah, because he knows me from 8 days, 8 years, and 8 decades.
Oh, so what was the effect?
Ang epekto aning pangitabua dako gid siya, dako siya epekto sa among negosyo bayan ning care home, which is may nakadaot sa development sa among statistics bayan sa negosyo.
He expanded 10 branches all over UK, and we are continually expanding.
That's good.
When the moon shines from the heavens above, life will be sweet, so demons are